Welcome. Today we're delving into a rare and often overlooked cardiovascular condition known as Midaortic syndrome. This condition, primarily affecting children but sometimes diagnosed in adults, involves the narrowing or constriction of the abdominal aorta, the main artery carrying blood from your heart to the lower body. Understanding this complex disease is crucial for early diagnosis and effective management. The exact cause of Midaortic syndrome remains unknown in many cases, making it idiopathic. However, several factors are thought to contribute to its development. These include genetic predispositions, congenital defects present at birth, and inflammatory conditions like Takayasu arteritis and neurofibromatosis type 1. Some studies suggest that vascular anomalies during fetal development could also play a role, leading to the aortic narrowing later in life. Further research is needed to fully unravel the etiology of this complex condition. Midaortic syndrome's impact lies in its disruption of normal blood flow. The narrowing of the aorta creates a significant obstruction, forcing the heart to work harder to pump blood through the constricted area. This results in increased blood pressure upstream of the narrowing, often leading to hypertension, especially in the upper body. Downstream, the reduced blood flow can cause ischemia, or a lack of oxygen, in the abdominal organs and lower extremities. Over time, this chronic reduction in blood supply can damage organs and contribute to the development of various complications. Midaortic syndrome is a rare condition, making it challenging to determine its precise prevalence. It is believed to affect fewer than 1 in 100,000 individuals. While it can occur at any age, it is most commonly diagnosed in children and adolescents. There doesn't appear to be a significant difference in occurrence between males and females. Because of its rarity and often subtle symptoms, Midaortic syndrome may be underdiagnosed. The signs and symptoms of Midaortic syndrome can vary significantly depending on the severity and location of the aortic narrowing. Common symptoms include high blood pressure, particularly in the arms, headaches, nosebleeds, and leg pain or cramping during exercise, known as claudication. Children may experience delayed growth or failure to thrive. Less common symptoms can include abdominal pain, kidney dysfunction, and even stroke or heart failure in severe cases. The subtle nature of some symptoms often leads to delayed diagnosis. Diagnosing Midaortic syndrome typically involves a combination of physical examination, blood pressure measurements, and imaging studies. A key indicator is a significant difference in blood pressure between the arms and legs. Imaging techniques, such as computed tomography angiography, CTA, magnetic resonance angiographies MR, and traditional angiography, are essential for visualizing the aorta and identifying the location and extent of the narrowing. Doppler ultrasound can also be used to assess blood flow velocity and detect areas of obstruction. A thorough diagnostic workup is crucial to rule out other conditions with similar symptoms. Midaortic syndrome can be classified based on the location and extent of the aortic narrowing. Some classifications consider whether the narrowing is localized to a specific segment of the aorta or involves a more diffuse area. It's also categorized based on whether other arteries branching off the aorta, such as the renal arteries, are involved. This classification is important for tailoring treatment strategies and predicting potential complications. Treatment for Midaortic syndrome aims to relieve the obstruction, improve blood flow, and manage associated complications. Treatment options depend on the severity and location of the narrowing. Medical management includes medications to control high blood pressure, such as ACE inhibitors or beta blockers. For more severe cases, surgical intervention is often necessary. Surgical options include bypass grafting, where a new vessel is used to deter blood around the narrowed segment, and angioplasty with stenting, where a balloon is used to widen the artery, and a stent is placed to keep it open. The choice of treatment is individualized based on the patient's specific anatomy and clinical condition. Currently, there are no specific preventative measures for Midaortic syndrome due to its often unknown etiology. However, managing risk factors such as high blood pressure and maintaining a healthy lifestyle can help reduce the risk of complications. Early detection and prompt treatment are key to preventing long-term damage to organs and improving overall outcomes. Genetic counseling may be beneficial for families with a history of congenital vascular abnormalities. The prognosis for Midaortic syndrome varies depending on the severity of the narrowing, the presence of complications, and the effectiveness of treatment. With timely diagnosis and appropriate management, many patients can lead relatively normal lives. However, untreated or poorly managed Midaortic syndrome can lead to serious complications, including kidney failure, stroke, and heart failure. Recent research focuses on developing less invasive treatment techniques, such as endovascular therapies, and improving our understanding of the genetic factors that contribute to the condition. Ongoing studies are also exploring the use of drug-eluting stents to reduce the risk of restenosis, or re-narrowing of the artery after angioplasty. These advances offer hope for improved outcomes for individuals with Midaortic syndrome.